Hello, my name is Eric Rubenstein, and I'm a postdoctoral fellow at the Waisman Center at the University of Wisconsin-Madison. I'm excited to share with you work by my colleagues and me that was recently published online at the Journal of Developmental and Behavioral Pediatrics. The title of this study is The Relationship Between Advanced Maternal Age and Timing of the First Developmental Evaluation in Children with Autism. Mothers who are 35 or older are at higher risk of poor pregnancy outcomes like preterm birth, stillbirth, preeclampsia, and gestational diabetes. Their children are at greater risk for being small for gestational age and having low birth weight, Down syndrome, or congenital malformations. In regards to their pregnancy, these women are considered to be of advanced maternal age, or AMA. Provider guidelines recommend clear communication about the potential for suboptimal outcomes, and studies have found that AMA mothers are aware of their increased risk. Although we still don't know a lot about the etiology of autism spectrum disorder, AMA is consistently seen to be a risk factor in large epidemiological studies of autism. We wanted to know whether the heightened awareness of AMA mothers about their higher risk of poor pregnancy outcomes extended to patterns in service use for child developmental concerns related to autism. Our objective was to estimate the associations between AMA and the age at which a child who would later be diagnosed with autism first had an evaluation noting developmental concerns, and then to examine the time from this first evaluation to their first ASD diagnosis. Our goal was to determine whether older mothers were more acutely aware of their child's development and whether more experience with the healthcare system led to quicker autism diagnoses. We used data from the Autism and Developmental Disabilities Monitoring Network, or ADDM network. The ADDM network is a biannual surveillance system that estimates the prevalence of autism in 8-year-old children from sites across the U.S. For this study, we used data from the 2008, 2010, and 2012 ADDM years, which corresponds to children born in 2000, 2002, and 2004 in 13 states. ADDM network abstractors look for key indicators of autism or developmental disability by examining school and health records of all children with at least one parent who lived in the site's geographic area. If these indicators are present, a clinician reviewed the record using a standardized methodology to determine whether a child meets criteria for autism. As part of the child's record, all developmental assessments or instances in which a trained professional at a different assessment noted a concern are abstracted, allowing us to know the child's age at the first evaluation that noted concern. The age at the first autism diagnosis is also abstracted, although some children with autism, as determined by the ADDM network, never received formal diagnoses. We determine AMA by the mother's age on the birth certificate. Analytically, we examine the association between AMA and age of the child at first evaluation and the time from the first evaluation to the first diagnosis using both unadjusted and adjusted quantile and Cox proportional hazards regression. In our sample of 10,358 children, 2,036, or 19.7%, had AMA mothers. The mean age of first evaluation noting developmental concern in those children was 42.2 months, with 11.5 months from evaluation to first diagnosis. In children of non-AMA mothers, age of first evaluation noting concern was 44.7 months, and the time from evaluation to diagnosis was 11.7 months. In our unadjusted quantile regression, we found that children of AMA mothers had their first evaluations between 1 and 5 months earlier than children of non-AMA mothers, with statistically significant different patterns in timing. However, once we adjusted for socio-demographic confounders like maternal education and race, we saw no difference between the groups. Additionally, there were no difference in time from first evaluation to first diagnosis in either group in unadjusted or adjusted analyses. So what does this mean? AMA is one socio-demographic factor associated with younger age of first evaluation noting developmental concerns in children with autism. But AMA is not independently associated with age at first developmental evaluation, likely because it is a consequence or cofactor of maternal education and other socio-demographic characteristics. Understanding how risk factors for autism impact evaluation patterns will help reduce age at diagnosis in those at highest risk. AMA may be a demographic factor to consider when screening and evaluating children at risk for autism.